in the hospital. Therefore, I couldn't understand why they were paging him staff. He, I understand, was approached in the hotel at the meeting by the sheriff, asked to come with him. They did not want him even to go get his luggage. He was taken, I understand, to a helicopter to a jet, and he was flown by jet to Love Field, and then transported by a police car very quickly to Parkland in time to arrive and operate on Governor Connolly. That was a negative exploration of the vessels in the leg. Connolly was moved to 2 East. Parkland was built in a T, so if you stood at the T, you could get a straight view into the windows on 2 East. There was concern that someone could get up on that south wing and look through the window, knowing where he might be, and shoot him. And so some lead shields, or steel, was put over the windows, and they used the first 3 rooms on the right of 2 East. There are doors, much like you have in a hotel, if you want to open up the doors between rooms, and they could move that lead in any one of those 3 rooms, and no one would know at any given time which room Governor Connolly was in. This is a chest x-ray that was placed in a book that we wrote subsequently. And Dr. Shaw, shortly before he died, a few years before he died, told me that this is an example of a sucking chest wound, and that you notice the date here, it's November the 24th. This is Governor Connolly's chest x-ray immediately post-op, and then on resolution of his chest injury. The next day after this occurred, we were asked to write something down as to what we did and what role we played in this. I thought that probably the staff would be very detailed about this, and my description was a little more superficial as a chief resident, as a 5th-year resident in surgery after medical school. So I wrote this on 1 page, and I didn't see it for a number of years, but it's stamped up here, top secret. I thought that was rather interesting to how they handled that information. This was not found for a while. The Secret Service came from San Francisco at one point in time the next spring and asked me where my description was, and I turned it in to Dr. Kemp Clark. He apparently had turned it over to Mr. Price, the hospital administrator, and it had been lost for a few months. Nevertheless, it was found, and what it says is that Dr. Perry and I rushed to the emergency room and found the president to be dying. Previously described severe skull and brain injury was noted. That is, I'm assuming that the staff was describing it, as well as a small hole in the anterior midline of the neck, thought to be a bullet entrance wound. So still within the first 24 hours, that was our assumption that this was an entrance wound. While Dr. Perry started tracheotomy, I performed a cut down on the left cephalic vein and inserted a large polyethylene catheter. Then it goes on to say we heard air coming out, and we put in chest tubes. The description of this rifle, as you know, shows under the wood grips and fingerprints of Oswald. The rifle that you've all seen supposedly was ordered by mail for $12.13 or 78 cents, and the scope for $7.13 or 78 cents, came out to about $20. So fingerprints were supposedly found in this area. Fingerprints were supposedly found in the boxes on the 6th floor of the school book depository. This is a picture of the possible rifle and the pistol used for Kennedy and J.D. Tippit. The Sunday paper mentioned that there would be a day of mourning ordered by the president, and the Sunday Oklahoman said Oswald the killer, case cinched in Kennedy's assassination. We know that it really was not cinched at that point. This is a picture of the casket in the East Room. The only reason I show this, battle to stay present, was feudal doctors knew. There are a list of doctors who were involved in that room that day, And I show it because Dr. Crenshaw's name is mentioned in that newspaper. You may recall when Dr. Crenshaw wrote his book, there was a lot of discussions whether he was even present in that room or not. He said he was. Dr. Phil Williams, who's a neurosurgeon here in town, said he remembers seeing him. He was a resident at the time. I did not remember seeing him, but somehow the newspaper article indicated that he was present. That was Friday afternoon, and Saturday about noon, we heard the report from Bethesda about the injury to the back. We were being bombarded by news media to give them a description. I know my hometown in Harrison, Arkansas, newspaper called me that afternoon. That was probably the big article of the day for Harrison with a population of 4,000 people. But we were on call every other night. I was on trauma call Friday and would be on trauma call again on Sunday. There was a bowling alley at the corner of Inwood and Lemon, and they had a barbershop there. We tried to get out once in a while to get a haircut, and so Sunday morning I run over to the bowling alley to try to get a haircut. You told the operator where you were. She called the bowling alley and said, there's been a stab wound to the neck, and another resident needs you to come in and staff that case as chief resident. So I left the bowling alley, went into Parkland, was outside in the doctor's office area in the operating room, and this was going to be a negative exploration, so I didn't even scrub on this neck, and the telephone rang. The nurse answered it, and I was sitting there. I had seen Dr. Perry and Dr. Jenkins in Dr. Jenkins' office as I came down the hall before I went into the office. She spoke for just a minute. She turned around to me and she said, Dr. Jones, Oswald's been shot, and they're bringing him to the emergency room. This was pretty stressful within about a 36-hour period of time, almost 48, to have this happen again. You begin to wonder how much more can we take. I went up the hall to Dr. Perry and Jenkins, and I told them that Oswald was on his way. Dr. Perry said, why don't you call Dr. Shires? He was chief of surgery. Let's get him involved in this time. So I called Robbie Joe, his wife, and I said, is Dr. Shires? And she said, no. And so I hung up, and sometimes you call Dr. Shires, he really was there, even though you were told he wasn't. So I called back, and I said, well, the reason I'm calling is that Oswald's been shot. She said, I knew that the first time you called me, but he really is not here. What had happened, he had been over to Parkland and was on his way home in the car, had the radio on, heard it, turned around, and came back into Parkland. Dr. Perry and Jenkins and I went to the emergency room, and I might mention in this slide, if you notice how Oswald turns to his right as he's shot by Jack Ruby. Ruby, we're told, was very incensed by his president having been shot, and had gone that morning to wire some money to Western Union, and then came down to the police station and was a well-known figure apparently there, was easy access to get down to where Oswald was. If you recall, everybody knew when Oswald was going to be moved, where he was going to be moved, theoretically how, and there was really no secret about this. What he did when he turned was, instead of taking this shot straight on, he turns and he gets shot right here in the left chest. And it goes through his diaphragm, much like a shish kebab, comes in and gets the spleen, comes across the abdomen. The aorta is the main artery out of the heart. There's a large vessel that supplies all the valves, the superior mesenteric artery. It blew that right off the front of the aorta. Now, the aorta is like a water hose. Came across and went through and through the inferior vena cava, which is the largest vein in the body, bringing blood back to the heart. Then went through the renal artery, renal vein, the kidney, and on into the kidney itself. And so his ultimate demise was a result of just massive blood loss. Now, one reason that there was some delay in getting him to Parkland was this decoy truck was parked in the ramp that went down to where he was. He was in the basement, as you recall, when he was shot. It took the ambulance service a little while to get him out, carry him up the street, get him in the ambulance, get him transported to Parkland. We went to the emergency room, and I was there when Oswald was brought in, as was Dr. Perry and Dr. Jenkins. This was a photo taken en route to the hospital, and that's pretty much the way he looked, eyes open. He was not moving, but he did have a heartbeat. I listened, and I thought, we're not going to get in this situation again. Is he alive or is he dead before we start? He had a heartbeat. He had no palpable blood pressure and no palpable pulse, but he was alive. Same sequence of events. I did a cut down of the cephalic vein. That's not a common place to start an IV, but I could see it and did it real quick. And Dr. Jenkins intubated Oswald, and we had him in the operating room within about 7 minutes from the time he came into the emergency room. There's an elevator that goes out of the emergency room at that time, past the first floor, which is where the cafeteria was, and up to the second floor, opening into the operating room. We got him on the elevator, and we made it to the first floor, and the elevator door opened. And here were the news media, and they were clicking pictures of him on the cart, and the police didn't know what to do. They couldn't leave Oswald, and yet they wanted to do something to the people that stopped the elevator that were taking the pictures. But somehow the news media knew about that elevator. That was subsequently changed so that elevator didn't stop on 1 anymore, but it opened directly into the operating room, and we took him to surgery. This is the way, I don't know where that blows up any or not, but this is the way that Parkland looked. You can see a policeman here, you can see them here. They were on every level of that hospital. The afternoon that Kennedy was shot, I had tried to call my wife, Jane, who was a dietitian at the VA. I couldn't get a phone out, and I thought, well, I'll go up to a payphone up on the 4th floor where OB-GYN is, and I'll use the payphone to get out. And I did, and talked to her, and she already knew about it. I thought I was giving her some quick information here. She knew about that. She came by for me later that evening, and you couldn't come into Parkland. It was blocked. Everybody had to be searched that came in. There were police cars up and down Harry Hines for as far as you could see. There was real concern. There were police even in the closets in the operating room. When Oswald came in, it was about 12 something. I can't remember the exact time, but he died at 1:07. That's Dr. Shires. This is the press around. All of us went down to talk to the press. The operative note shows that Dr. Shires was the surgeon, assisted by Dr. Perry, Dr. McClellan, and me. Gives the nurses. Estimated blood loss was 16 pints, and that's what he was given with blood. And he received some IV fluids, about 6 liters, and said in the operative note that he expired at 1:07 p.m. He never received any significant anesthesia, just oxygen. He never got a blood pressure up to above about 60, normal being up around 120. And about the time everybody got control of all the blood loss and the bleeding, blood pressure went down and he expired. We did open his left chest because he had just expired, and the chest tube was in place. The missile on this side of the abdomen was removed. This is his autopsy picture, and I think this is about where he was shot. This is a wide incision that they do for an autopsy, and his chest tube was placed about right here. Ruby was then arrested. He had owned several nightclubs in Dallas. I think the Singapore Club and what was the other one? Carousel was the other nightclub. And really not made very much money as far as the nightclub was concerned. Then the day of mourning came the following day after Oswald was shot on Monday. This is an ad run by Neiman Marcus at the downtown store. The Preston store would be closed all day that day. And as you looked around the country, there were scores of college football games that were scheduled for that weekend that had been postponed. NCAA cross-country championship postponed. Race events postponed. So it was truly a day of mourning. Ms. Kennedy, along with several of the world leaders, including de Gaulle and Prince Philip and Haile Selassie and so forth, from all over the world came to the funeral. Ms. Kennedy leading the funeral procession. Another interesting point. I mentioned that I'm from a town of 4,000, at least when I left there, and was involved with the assassination and with Oswald. Oswald being accused of the assassination, the family perhaps was having a little difficulty in finding a minister who wanted to preach his funeral. And so they found a minister in Fort Worth, and it just so happened that Reverend Sanders was a minister in one of the churches at Harrison, Arkansas when I was there. So here, and all over the world to get somebody, two people from a small town of 4,000, both involved in the event with Oswald. This is a picture of the crowd. The person standing down here shortly after the assassination, looking at what the possibilities were. This is Secret Service. View from 6th floor. This is supposed to have taken a minute before the assassination. The picture, this sign's always in the front of the movie strip. Coming right from behind that sign, the arms go up, and that's supposed to be an indication of injury to the spinal cord. It's a reflex motion. Connally still has not turned around. You see the president's head here. Notice how close her head is to his. It's amazing that I think that she was not hit as well. Connolly's beginning to turn around at this point, but it looks like the back of the head is still intact there. Here, close up, looks intact here. Her head's right in front of you. Connolly has now turned around. Head still looks intact. And here it's not intact. And Connolly is falling over. Is Kennedy getting to the back to get one of the agents into the car? Now Mr. and Mrs. Governor and Ms. Connolly are down, as is the President. And I just show quickly that you've seen this Zapruder film, I think. We'll go ahead.
Yeah, never. Yeah.
Shortly after the assassination occurred, Mr. Price wrote this note, and talking about Parkland said that. All right. I think this is 18 frames. fact, Ms. White's made arms up. Not much question, but there's 2 shots fired.
Is that the unretouched version?
Hopefully. I guess that was at 30 and this is 18. Arms are up. Off. This just says that Parkland Hospital became the seat of the government of the United States, the temporary seat of the government state of Texas. It was the site of the death of the 35th president and the ascendancy of the 36th president. It became the site of the death of President Kennedy, and twice became the center of attention of the world, of Oswald, and continued to function at close to normal as a large charity hospital. On November the 29th, President Johnson then decided to appoint a commission to evaluate the assassination of President Kennedy, and it would be when the 88th Congress convened on January. Gerald Ford, Earl Warren, Alan Dulles, Counsel Lee Rankin. Then I believe in January the 29th now, a little over 2 months after the assassination, I received a subpoena to testify at the trial of Jack Ruby. And this was a subpoena addressed to Dr. Shires, me, and Dr. Jenkins. Here we are as we were called down. We actually never did testify. But this is Dr. Shires, Steve Landgren, the administrator at Parkland, Kim Clark, and me. Shortly after that, I received an airmail letter from the President's Commission on the Assassination of Kennedy, and it was from Lee Rankin. And it said, as you know, the Commission's been established to report on the circumstances relating to the assassination of President Kennedy and the killing of the alleged assassin Lee Harvey Oswald. One of our staff members, Alan Spector, plans to be in Dallas on Friday, March the 20th, and at some time during the following week, he'll contact you regarding our inquiry and testimony that will take place at Parkland Hospital. And now you know that Arlen Spector is the senator for Pennsylvania and presidential candidate subsequently for the United States. Now, the reason I show this is that it came up as to whether or not we had any experience with gunshot wounds. About this time, I reviewed our experience. We were seeing 146,000 patients a year in the emergency room. We were seeing 1,200 gunshot wounds, over 1,000 stab wounds, and over 5,000 auto accidents per year. You calculate that out, you're seeing about 4 gunshot wounds a day and about 3 stab wounds a day. Some of those were so-called flesh injuries. They didn't require admission to the hospital. But if you look at those that were admitted, many of whom were operated at that time, we were seeing at least probably operating 2 gunshot wounds a day and 1 stab wound a day. We were averaging 400 patients a day in the operating room. And this just mentions that Assistant Counsel came up with the single bullet, the magic bullet theory. We can flip carousels here to the other one. I might just mention while they're doing this a little bit about my testimony before the Warren Commission as to what we went through with this. When I was brought in, Mr. Spector said, "Did you observe any wounds?" And I said, as we saw him the first time, we noticed that he had a small wound at the midline of the neck, just above the suprasternal notch, and this was probably no greater than 1/4 of an inch in greatest diameter, and that he had a large wound in the right posterior side of the head. He said, can you describe this precisely? And again, I said, no larger than 1/4 of an inch. No powder burns were noted. That Dr. Perry had started the tracheotomy, and I did the cut down and got the IV started. He said, after the tracheotomy was done, and the intravenous fluids and blood was started, I believe the President was administered some hydrocortisone because of his history of adrenal insufficiency. And at this time, an electrocardiogram had been connected. I mentioned this, that the electrocardiogram had been connected, and it showed no evidence of a heartbeat. And I said that closed cardiac massage had been begun, and that I believe after about 5 minutes there was no activity, and so he was pronounced dead. Mr. Spector said, what history did you refer to of President Kennedy's adrenal insufficiency? And I said, as I recall, it had been in the news that the President had had several years ago some type of steroid therapy, and that Dr. Carrico had observed this. He said, did you obtain that history from Mrs. Kennedy or any other person on the scene? I said, no. Our inspector said, you just relied upon what had been occurring in the news. And I said, yes. He said, what would have happened, if anything, if the President had no adrenal insufficiency? And I said, this would not have caused any severe effects on any organ at all if the adrenal gland was producing enough steroids. Because people can go into adrenal insufficiency with severe insults if you don't administer steroids. He said, Dr. Jones, I now hand you a report, and in the report you state that there was previously described skull injury and brain injury. And it's also noted as well that you noted a small hole in the anterior midline of the neck thought to be a bullet's entrance wound. He said, what led you to the thought that it was a bullet entrance wound, sir? And I said, the hole was very small, relatively clean, as you would see of a bullet that is entering rather than exiting from a patient. If this were an exit wound, you would think that it exited at a very low velocity to produce no more damage than this had done. And if this were a missile of high velocity, you would expect more of an explosive type of exit wound with more tissue destruction than this appeared to have on superficial examination. He said, would it be consistent then with an exit wound, but of low velocity, as you put it? And I said, yes, of very low velocity to the point that you might think that this bullet barely made it through the soft tissues, just enough to drop out of the skin on the opposite side. At that point, I didn't know that a missile had been found on a cart that afternoon when Kennedy and Connolly had been brought in. So that created a little bit of concern. Said, have you ever had any formal training in bullet wounds? I said, no. He said, have you ever had an occasion, but that I'd seen several, he said, have you ever had an occasion to observe a bullet wound which was inflicted by a missile of approximate size of 6.5 millimeters, which passed through the body of a person and exited from a neck without striking anything but soft tissue from the back through the neck, where the missile came from a came from a weapon of the muzzle velocity of 2,000 feet per second, and the victim was in the vicinity of 160 to 200 feet from the weapon. And I said, no, I've not seen a missile of this velocity exit the anterior portion of the neck, but I have in other portions of the body, but not the neck. And we went on to discuss striking arm and so forth. He said, Dr. Jones, did you have any speculative thought as to accounting for the point of wounds which you observed on the President as you thought about it when you were treating the President that day or shortly thereafter? And I said, with no history as to the number of times that the President had been shot, or knowing the direction from which he had been shot, and seeing the wound in the midline of the neck, and what appeared to be an exit wound in the posterior portion of the skull, the only speculation that I could have as far as to how this could occur with a single wound, and we didn't turn him over, so we're still working with a single wound, would be that it would enter the anterior neck and possibly strike the neck bone, the vertebral body, and then change its course and exit in the region of the posterior portion of the head. However, there was some doubt that a missile that appeared to be of this high velocity would suddenly change its course for striking at the present time. If I accounted for it on the basis of one shot, that would have to be the way that I accounted for it, and so on. So you can't go back and change what you initially thought, that you were seeing that first day. Now, you can be changed by things that the Warren Commission may find, but that was our impression the very first time that we saw the president. Got it. May not be seated all the way down. Let's see, just a second. Now, you know, the Warren Commission report then came out. A lot of books came out. We were interviewed a lot of times. That's one by David Lipton. And he just mentions that it was our inspector's hypothesis, later to come to Warren Commission conclusion, the bullet which exited the front of the president's throat had gone on to strike Governor Connally. And for it to work, a throat wound not only had to be one of exit, but one that caused by a missile exiting at 800 feet per second. Otherwise, it wouldn't have the energy to cause Connally's wounds. But the doctors at Parkland described only what they saw. Dr. Jones summed it up in one brief sentence. The hole was very small and relatively clean cut, as you would see in a bullet that's entering rather than exiting from a patient. Dr. McClellan, an assistant professor of surgery, who was also there, but was not there before we made the incision, said if I saw the wound in its state in which Dr. Perry described it to me, I would probably initially think this was an entrance wound. Dr. Jones testified that he thought it was caused by a whole bullet, only if it was traveling at extremely low velocity, to the point that you might think that it barely made it through the soft tissue. Now, in this book called Mortal Era by Menninger, Jones's troubling conclusion that the throat wound seemed to be one of entry was bolstered by the results of a test conducted in early 1964 at the Army's Edgewood Arsenal in Maryland by Dr. Oliver, a researcher. Oliver fired 3 same types of bullets through a simulated human neck consisting of 14 centimeters of goat meat between goat skin and clothing, and to determine the size of the exit. And the entrance wounds were the same size as the one in Kennedy's back, but he found that the smallest exit wound that he could make in the front was 10 millimeters, which was more than twice the size of the injury to the front of the neck. So he concluded that this was that would be compatible with an exit wound. However, Donahue quickly said that the reason that this was so was that Kennedy had on a tight shirt and that his skin stretched as the bullet pushed through from the inside, but only because it was tight against the collar, and it was much and left a clean hole, much like a sharp stick would on a sharp stick would pass through a taut sheet of rubber, and then it would contract back down. So there was differences of opinion even in simulating an entrance wound and an exit wound. All familiar with the pristine bullet, and that's one fired through just the wrist of a cadaver, much less through other soft tissues, and it did a fair amount of damage in that firing, but this bullet has virtually no damage to it. It would be hard for me, even today, to think that this bullet could strike a wrist and not cause any significant damage and shattered bone. That's the back of the coat where the bullet went in. And since they didn't know that there were fibers up here, they didn't know that he had been shot in the neck, I think all of these studies with the tie probably must have been done later, but the pathologist says that the fibers would indicate that they were going in an outward direction at the tie and an inward direction in the coat, supporting the theory of being shot from the back to the front. Robert Gordon's book, Harry Livingston wrote another book on high treason. This one, They Killed the President. In this one, they said Dr. Ronald Jones, one of the Dallas doctors who observed the wound, never changed his mind. The hole was very small, relatively clean cut. I'm not saying I never changed my mind. I never changed what I said that I thought I saw initially. Some people have obviously talked about the photos being fake. The killing of a president. This is a picture of the skull. You can see why you might have facial relaxation. Here's what the autopsy looks like. There is this divot right here. Perhaps this was covered over. I do not remember seeing that little nick in the face. We were interviewed separately for this book, and each one of us is telling the author what we thought the posterior wound, the location of it. Separate rooms, everybody's holding their hand the same way. There's a whole page of these. I get a lot of correspondence, and Brad, I don't know whether one of yours is in this stack or not, but
Been a long time.
we do get quite a few, and things like this. I remember Brad calling me from the school. You get some, I don't have time to go into what you get into sometimes with people calling you and telling you who they are when they're really not that person. I don't know whether Brad knows it or not, but I didn't answer his call the first time. I called back, talked to the school principal, and asked if such a study was going on. He verified, yes, that it was, and I called Brad back and talked to him. To give you an example, I got a call one night about midnight, and the guy said, I'm a student at UCLA Law School, and we're writing a chapter, a book on the assassination. My part is to describe the tracheotomy wound. And we talked a long time about the tracheotomy wound. Subsequently, I read a book, and the author said that he couldn't get in contact with several of the Dallas physicians. And so he talked to Dr. Perry, and the way he approached Dr. Perry was that he posed as a law student and talked to him that way. That rang a bell. I had talked to the same guy who had posed as a law student to me. So you never know when you're going to be, who you're talking to on the other end of the telephone line.